So Prostate Cancer Patient Empowerment Program, PC-PEP, .org is a 6-month daily home-based program that is very comprehensive health promotion program for any man who's had a prostate cancer diagnosis of any stage at any time. And what we've been able to see, we're now in the midst of a phase 4 international implementation trial that's now ongoing on 4 continents, and we're growing. So we're actually looking for clinicians in multiple countries to contribute patients that are free for the patients and actually free for the clinicians as well. So the update is that we're finding that there are subpopulations of patients that are actually benefiting just as much, if not more, than the men in the general population. So we looked at rural patients, so we worry about the fact that we don't have access to kind of in-person programming, and so these men can access the program through their internet. And we showed that the men in rural Canada, rural international globally, benefited just as much as those who lived in urban centers. Secondly, we looked at the LGBTQ plus community. These men are actually at a very high level of distress coming in, have a lot of issues around discrimination within the medical system and so on. And what we showed is that through going through the program, they actually had a greater impact. They had more improvement in their quality of life, better improvements in their mental health than the average. So they really benefited, partly because they're drawn into community, they're getting specific programming that we're helping for. We've analyzed these 800 men as well, looking at men from the African Canadian community or black men, and it seems that there's a particular issues they're facing erectile dysfunction, for instance, urinary issues, and they seem to also benefit. So multiple populations seem to be benefiting. And the other really exciting thing is that the phase 3 trial showed that mental distress was improved at 6 months and 12 months, and we've actually looked at the phase 4 trial, so the international trial, and it maps exactly onto that curve. And so we're getting reassurance that the program is very helpful in multiple cultures for multiple men.